Hello. So what would a video be without talking about COVID? And unfortunately, I have more difficult news. We have a new variant called the Mu variant, MU variant, and it now is showing up in every state but Nebraska so far. Delta certainly outnumbers it significantly. In New Jersey, we know our numbers are 90% of the new cases are indeed the Delta variant, and we are seeing a very, very fast spread. And unfortunately, a definite increase in our number of patients that are coming in with COVID. It continues to just test everybody, right? The folks who were absolutely sure they would be immune and they wouldn't have to worry about it now find themselves in our hospital beds. And that is just a distress. And we continue to work forward to make sure that we're doing everything we can to answer people's questions and provide the vaccine. So here are our expanded pod hours that we are starting now, listed above. We obviously will continue to adjust those. You, I'm sure, heard the same news I heard over the weekend that the FDA is recommending for everyone 65 and older, and there may be some other categories as well, both healthcare workers and potentially teachers. And that recommendation goes to the CDC, and the CDC will ultimately make the recommendation on how that gets rolled out to states. In addition, children ages 5 to 11, Pfizer submitted the data this week, early in the morning, with the FDA for their review. Now that review process, remember, because this is done based upon 20 years of science and all of the work that has been previously done, will be expedited just like the others were done, and it will be given emergency use at some point this fall. Now, a week ago, we were hearing that was going to be December. This morning, I heard it could be as early as November. Whichever it is, we'll obviously be ready to comply and work with our school districts and our parents to make sure we get that vaccine out as quickly as possible. I also want to share with you some really amazing news because of all of the work that's really been done that I keep talking about to you week after week. We've had some really great recognitions. In Gloucester County, we were recognized as #1 in health services, and we take that honor very seriously. That's something that's voted on by the public. So the fact that that happened is something we're tremendously appreciative. Our own Dr. Evelyn Ballaghan was recognized. She's a leader of our urgent care and employee health and has been on the front lines side by side, answering every single question, both from community members as well as our employees. We really are so proud to work with Dr. Ballaghan and so grateful. In addition to Dr. Ballaghan, we're so pleased that the docs that are listed above have all been recognized by SJ Magazine as top doctors. And they work either employed by the Inspira system or part of our Inspira system, working in the community side by side. And we're so grateful again for all their work and all of the frontline workers. So in addition to all of the provider recognitions, this week actually marks National Rehab Week. And we have a huge number of opportunities for you to use our rehab services. We offer 8 locations, and all of those team members are just so amazing to walk with you on the journey, whether it's a hip replacement, whether it's coming out of COVID. We have the long hauler program you've heard me talk about. Our rehab services are there and welcoming and willing to partner with you through that process. When I speak about partnership, I want to tell you about this amazing story today about one of our patients, Tracy Worrell. Tracy's a mom of 7 kids. She's a sign language interpreter, and she found herself with a very rare form of breast cancer. So she came to Inspira's Leading Edge Cancer Center in Mullica Hill, and what she found was a whole team of people who were partnering to make sure that they were with her every step of that. Doctors Tubb and Kulkarni and Lofton and Lowther and our navigator Barbara DiMatteo, they became part of her family. And what Tracy shared with us was that when she was in sort of the darkest moments of it, notes would come to her from other patients who had been where she was. And what she felt was just that sense of not being in this alone. And it's just been amazing because what Tracy got was an all clear, full remission. Now we'll do the tests and we'll be right with her through the journey, but what she said now is the most important thing for her is to be able to write those notes to other people, to be able to get back to her children in the full way she wants to, and to be, most importantly, able to go back to work as a sign language interpreter, because those are the things that fill her soul. Tracy, we are so grateful, A, that you trusted us, and B, that we were able to come together with you and celebrate this great accomplishment. Until we meet again, be well and stay safe.